So the main thing we're talking about today is need. The main purpose, so you have a lot of purposes on your day one, but nothing is more important than need. Now this need may already have been discovered if you're getting referrals from the chiropractor, because they're supposed to get need too. And need is that thing. So you have all the requirements. On the day one, you do the history and the mechanism of injury. That's important because you got to get the right diagnosis. And your job as a doctor is to find the diagnosis and recommend the proper treatment. That's your whole job as a doctor: diagnosis, treatment. But need is critical as far as patient management goes, because all human beings are motivated by emotion. Emotion tells you what's important to you, and it drives all behaviors. So we're going to actually add this as a critical component. In fact, I think nothing's more important than getting the right diagnosis and treatment, but it is highly important that you understand what needs the patient has and is driving them to be here, and if they have any obstacles. So the reason we've structured our day one the way we have is to build trust. And the reason we're trying to build trust is not just so they do what we say, but so that they will share with us what's really bothering them. So, for example, a patient's not just going to walk in, okay, some will, they'll walk in and go, I'm here because I can't wipe my butt. Because I can't twist when I'm on the toilet, I need help wiping my butt. And some patients won't tell you that unless you've built sufficient trust to where they feel safe. And so that's why we build up trust, and that's why we don't start with need. That's why we ask we bond with them, we start resolving any obstacles. That's why we spent so much time talking about those stupid 2 first questions. How'd you hear about the office? And why are you here? And then we're going to bond with them by being a very good active listener. Active listening builds trust crazy fast. And then after you build trust, so you do active listening on something that's relatively safe. Tell me about your condition. Where does it hurt? How long does it hurt? Scale of 1 to 10. Is it sharp, achy, burning, dull? You guys know how to do this. Just memorize it. Boom, boom, boom. Go through it really quick. Then once you get all that information, now there should be starting to relax, right? And then you want to jump into specific, and that's where these are the important questions. What activities are restricted? What can't you do? Mm-hmm. And then the next question is going to go into, how is this affecting your life? These are the big questions. And this is also the most skillful portion. This is, other than the doctoring side is easy. This is the human side. And this is, how is this affecting your life? Now, the key here is we're going for emotion. Because one person may go, I can't work. I'm in so much pain, I can't work. And you're like, that's it. That's devastating. Hang on, you don't know that. It may be devastating to you to not work, but to my son Tanner, he's excited about that. Okay?
Not me, the other one.
Yeah. Colton, it's devastating. I can't work, I got goals, I got things I want to do. Tanner's like, I'm going to watch cartoons all day. Japanese cartoons all day long. That's what he loves. So it's critical, and this is the big mistake doctors make, is they think they figure out, the patient says, I can't sleep, I can't work. And really, it's they gained 5 pounds because they couldn't work out. And that's the motivating factor. So there's always one motivating factor. Always one big one. There may be 10 things they can't do, there may be 10 good reasons, but there's typically only one motivating factor.
And that's usually the breaking point in why they came in now
Yes.
and not 5 months ago.
Right. It's exactly it. So this gets trickier for you, Amanda, because we know when patients come in that their pain level is at least a 7, and that it's affecting, and the 3 big motivating factors are work, sleep, and self-care. Those are 90% of them. A few of them are going to be weightlifting, a few of them, but it's work, sleep, and self-care are the big ones. So we're going to hit those really hard. Okay? Now, like I said, they're going to come from the patient, and the need should have already been established. The doctor, you can check the chart note. when I do my chart notes, especially on a day one, if you read any of my chart notes, you should see the words, the big problem is, somewhere in the paragraph. When I'm kind of narrating my overall scheme, I always write the big problem is, because that's my trigger, the next thing I say is the primary need and how it affects their life. That's what I'm gonna do. So we're looking for need, we're trying to build trust, and the way you dig, so this is psychology, and the way you get need is you always start with an open, and this is, I think I've taught you this before, you always start with an open-ended question. So it's gonna be, what area of your life, how is this affecting your life? The reason for an open-ended question is if there was some big thing that's important to them, this will pull it out of them. But it's just step one, okay? You understand open-ended questions, okay? Just gives them an opportunity to share what's really on your mind. Most of the time, there's nothing. So now you're gonna go deeper, it's a deeper dive. You're gonna go deeper into their psyche, and you do that through what we call menu. Yeah. So if I said, what'd you do yesterday? I went to work. Now I have to get more specific because you were too vague in general, and I want high specificity. So I'd say, what did you do yesterday morning? Did you have any interesting patients?
Oh, I did. I treated Anna's friend.
Yeah, see how fast I just went. And you see, it took him a second. He now had to concentrate, and I forced your brain to go deeper into there. And I could have said, just like I said, what'd you have for breakfast? I could have said, what'd you eat yesterday? But a menu is designed to be specific. So when you menu, those are the times where you go, so I said, how's this affecting your life? Slows me down a little bit. What about work? How does it affect you at work? That's much more specific, and it forces their brain to actually go, what did I do at work? Does it slow me down at work? And they start to dig. This is really important. So it's gonna be work. I always start with work. How's this affecting your work? It doesn't. I'm fine. Doesn't slow you down at all. Do you have to work slower? Do you monitor? So now I can menu that even deeper. So I can go, does it slow you down? Do you have to modify what you do?
Can you talk about fear-based pain stuff at all?
Yeah, of course.
Okay.
Of course. Yeah, and we'll do that. We'll talk about that. So, same thing, you go to sleep. And then if they go, and then you would go to hobbies or self-care. Does this affect how you dress, how you bathe? So the first thing you're gonna do, and this is where you wanna go ultra specific, high specificity is the key. So if they say, yes, it slows me down at work. How does it slow you down at work? Well, I can't do it as well. That's not a good enough answer. Would you say, and so we use scaling, would you say it slows you down 10%, 20%, 50%? Oh, it slows me down 40 or 50%. So you could work twice as fast. You used to work twice as fast as you do now, right? Or you used to work twice as hard, or you used to ask for help, right? So you're gonna quantify all these things as much as you can. Why do we wanna quantify?
So we can track progress.
Track progress. And it's huge for psychology because I promise you, they're gonna forget all this stuff. As soon as they're out of pain, people don't like to remember painful memories. So what happens is they get better and they're like, let's say the patient improves 80%. You're thrilled because they're 80% better. I promise you 3 months later, they're gonna go, I wasn't that bad anyway. But when you can get highly specific, that triggers very good memories. So I put in my notes, slows them down by 40% at work. Very, very, very high detail specificity when it comes to need. I'm measuring everything as much as I possibly can. Sleep, how do you get more specific with sleep? It does affect me sleeping.
Difficulty falling asleep,
Yeah.
difficulty staying asleep, do you wake feeling well rested?
Exactly, and then
How-
get more specific.
How long does it take you to fall back to sleep? What's waking you up?
How many hours of good sleep did you get before your neck bothered you? 7. How many do you get now? They'll be specific. Oh, I only get about 3 hours of good sleep. What's your quality of sleep? Scale of 1 to 10. a 5. What was it before that? I'm putting that in the chart notes. Because it's neat, that's important, and that's what I want to go back later and remind them how jacked up they were. And they go, oh yeah, I can't tell, almost every patient is like, I forgot how bad it was. And I can remind them by going into high detail. You said your pain was a 5, and it's actually happened where patients are mad at me for something or claiming, I didn't get that good results. Boom, 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 boom. They're like, oh yeah, changes their demeanor really fast. It's saved my butt many times, and they walk out going, okay, I guess you really did do a good job. So it's self-protection. But